Well, good afternoon. I want to thank everyone for being here. Thank Blake Medical Center for hosting us. I want to thank Randy Curran, CEO of Blake Medical Center, and also my friend, Senate President Bill Galvano, for being here. We also have Representative Will Robinson. We have Dr. Ravi Chari, HCA West Florida Division President. I want to thank him for being here. We have Chari West, Manatee County Administrator, and we have Dr. Scott Self, who's the an ED doctor here at Blake Medical Center, and I think we'll offer some interesting thoughts as well. So thank you all for being here. We'll go over some of the things that we're doing in terms of the COVID-19 response. Of course, our mission really focuses on protecting the vulnerable. We, from the very beginning, wanted to expand testing. We are definitely doing that. 2 days yesterday, we reported 95,000 tests. Today, I think we're over 80,000 tests. To put that in perspective, Taiwan has done 78,000 tests the entire pandemic, and they're 23 million people. So we're definitely doing a lot of testing, practicing social distancing, and supporting hospital and healthcare workers. A couple updates on some of the things that we've been working on. Today, hospitals throughout Florida will be getting additional shipments of the therapeutic remdesivir. That had been something that a lot of the physicians have been using. We got positive responses for it. Of course, that's a new therapeutic that had been developed by Gilead and had been given an emergency use authorization by the FDA. We're scheduled to get some more later in the month, but there was a need to be able to expedite that. So I worked with the Vice President and I worked with Secretary Azar to get that expedited so that there wouldn't be a gap in treatment. So those will be arriving today, and that will be a lot of vials, and hopefully we'll be able to serve the patient's needs. We also have more than 1,000 personnel, contract personnel, who are going to be deployed around the state to offer support for different services that are being undertaken. Some of it will be long-term care, COVID-only facilities. Some of it will be supporting some of the normal medical operations. Some of it may be supporting testing. When we talk to people around the state, particularly with the hospital system, a lot of it's just making sure there's enough personnel to do all this. COVID is very labor intensive. There's a lot of procedures that go in place in terms of the isolation. Obviously, they have a lot of personnel who are involved in testing people, both who come into their hospitals and people who are participating in some of these drive-through or walk-up test sites. So the personnel is something that's very, very significant. So we're doing a lot of that to be able to help. So if you look at kind of where we've been now with this testing, when we first started out, the tests were very scarce nationwide. I think Florida probably had more test results in one day yesterday than probably the country did as a whole in the beginning part of March. So if you look, we had about a 10.8% positivity rate at the end of March, beginning of May. That kind of went down, and then we really had a good stretch from kind of the end of April through that June 13th, where we were 5.1% or under. Sometimes we were 2-3% in terms of the positivity. So as the cases expanded, or excuse me, as the testing expanded, the positivity was manageable. So yes, you had more cases, but that was kind of what you'd expect. If you test 200,000 people at a 3% rate, you're gonna get more cases than if you test 100,000 people at that. And then I think as you see, when we started to see more cases, yes, we've been testing more the last 3 weeks by far than we have before, but you see the that 614 to 620, the positivity then goes up to 9.6%, and then the next week in June, 12%, and then we were 14.8% for the last part of June, beginning of July. This week so far, it's ticked down a little bit. Last 2 days, I think, have been in about 12.5%. If you look around the state, there are definitely areas where we think we may be seeing some declining positivity. And there are other areas that have been pretty consistently 20% range, like Miami-Dade. Here in Manatee, they've been about 10% the last 2 days. and the majority of their new cases have been under the age of 45. Sarasota is reporting today 5.2% of the tests positive. Yesterday was 9.5%. And I think some of the folks here will attest that we may be seeing some decline in this part of the Tampa Bay area. Some of the other areas, particularly north in places like Pasco, you may be seeing more positivity. But this is something that we're looking at very seriously. So we're going to get the test results to complete the week. We're going to be over 400,000 tests easily for the week. So that's a huge amount of tests. And a lot of it is this positivity rate. There's obviously going to be some prevalence, but if it gets into the single digits, that's something that's much more manageable. So we increased from the end of June into July, but then have it's been plateaued for the last 2 weeks, which is a good sign. We'd rather be plateaued at 4%, but we didn't want to see it continue to just go up and up. So we've tested 2.4 million people. That is 1 for every 9 people in the state of Florida. So it'd be interesting to see what other things have been tested at this level, in our country in modern times. But this is something that, as a whole, the country's done a lot of tests. Obviously, Florida, we're doing a lot, particularly in the last however many weeks when the demand has really been high. If you look at where the cases are coming from, a lot of the cases are in that between 15 and 54. Which, as you can see, those are not the age groups that are producing significant fatalities. In fact, if you're under 55 and you don't have significant comorbidities, the fatality rate for this is incredibly low. You look, the 75 and plus, 85 and plus, those are where the bulk of the case fatalities are in terms of those who are positive cases. And a lot of that's nursing homes. I'll talk about some of that in a minute, but we really believe that those in that 65 and up age group are at the increased risk, and we're continuing to advise them to limit close contact outside the home and to avoid crowds as much as possible. But this is a pretty dramatic, I think, picture of showing how this virus operates and who tends to bear the brunt when they get infected. And to that 25 to 34, if we were going back 6 weeks, it would not have been anything special on this map in terms of how many tests. I mean, they had been positive tests there for sure, but that's been a real dramatic increase in terms of the number of positive cases in that age group. And if you look, far and away now, they're the number one age cohort, that 25 to 34-year-old. And if you look to see each individual age, how many there, we're still 21 is still the number one age that has the most cases. Obviously 21, absent a significant comorbidity, is very likely to be an asymptomatic or mild illness. So one of the things you do, when we look at these cases, and I know a lot of people like to talk, it gets reported, but when cases are reported to the state, that's a positive test that could have been taken 7 days ago, 8 days ago. There's all these companies that do it, they report it. When that infection occurred is not even clear. Some of these infections may have occurred 2 weeks ago when a test finally gets reported to a state from a private lab. So one of the things that you look at is, okay, I can get a certain amount of test results reported today, then next week, and there's all kind of ways you can look at that, and there's all kind of ways that the data, may not always, come in kind of a coherent fashion. But when you look at like ED visits for people showing up to the ED because they have either influenza-like or COVID-like illnesses, that is just evidence of what's going on. And the more people that are doing that, the more prevalence that you have. So if you look at kind of what we've seen over the last few weeks, throughout the month of May, it was very flat. Statewide, we were under 500 visits a day, which for a state of 21.5 million people is, is a small number of visits. Influenza-like illness, 250 or below, pretty much for weeks and weeks. And then even as we got into June, it was still very low. You start to see it inch up as we get into that third week of June. When we get into the 614, it goes up. You start to see more visits. And then the following week, it escalates more. And then at the end of June, it escalated to where we were seeing more than 2,000 ED visits a day for COVID-like illness. Now, going to the ED doesn't mean you're going to be admitted to the hospital, but it means you're showing up, and if you're symptomatic, a lot of times they are testing you. Now we have seen statewide, this start to trend downward, but you look at a couple days, and sometimes that can be more noise than signal. So we want to continue to look at that. I think they'll talk about here the ED visits have skewed younger and kind of that 35-year-old range, which obviously is a different kind of clinical cohort than the 65 and up. But that the syndromatic surveillance and looking to see that is very instructive in terms of what we're doing or what's going on in the state of Florida. So protecting the vulnerable, you see the fatalities skew 65 and plus, and really 75 and plus when you think about it. So this is something that's a priority. Given that you see more prevalence of this in the community today than we did, say in the middle of May, it is important for those in the at-risk groups to avoid crowds and minimize the close contact with people who they don't live with. Now, of course, if you're in a multi-generational living arrangement, there's definitely risk with that, and we've seen that in different parts of Florida where you have some of the multi-generational housing, a lot of crowded housing lead to more outbreaks. But obviously there's only so much that you can do when those are your living arrangements, and we understand that. But there is the risk in the 65 and up category. And then underlying conditions, obviously if you're 65 and up, even elevated risk, but really any age that has some of these conditions, you need to take similar steps and avoid the crowds, minimize close contact outside the home. One of the things when you have folks who are under 65 or really even under 50, the ones that have things like diabetes, morbid obesity, those are the ones that typically have a much harder time with the coronavirus. And so just understand that and take whatever precautions that you can. We talked before coming out here about long-term care facilities, which is really a really significant component of this. When we started this in March, we obviously knew that the nursing homes were going to be ground zero because you have the most vulnerable population there. So we did things like we prohibited visitors. So you've been had visitors in nursing homes since the middle of March. That's a tough thing for a lot of people, but we feared that you would see more introduction of the virus if you allowed that. We also prohibited hospitals from discharging COVID positive patients back into the nursing homes. I think when that was done in other states, that really had negative consequences. We felt that was the better course of action. We required PPE like N95 masks. We sent 10 million masks plus to long-term care facilities, face shields, gowns, gloves, all that. And so we required them to use the PPE, but we provided the PPE because we understood that was important to try to minimize spread within those facilities. But we also understood as we started to get into April that, even with doing all those precautions, you would still have it get in with a staff member, maybe not wearing the PPE right, maybe just PPE wasn't as effective as we wanted it to be. But so you would see cases there. We sent the National Guard to do a lot of testing in the nursing homes because we understood that we needed to identify cases before they could spread like wildfire. And so we understood that there was a need for some of these folks who, if you do test positive and you're a resident of a long-term care facility, that you had to be isolated appropriately so that you didn't spread it to other residents. And some of these nursing homes, long-term care facilities, they're just not set up to do appropriate isolation. And so we said you need to transfer those folks. Now, some of that was just sending them to the hospital where they're basically just boarding because they are medically stable. So we felt that wasn't probably the best use of hospital resources if we could help it. And so we've now established 13 COVID dedicated nursing facilities in the state of Florida. So these are nursing facilities that all their patients are COVID positive. So if you have somebody who tests positive in a nursing home in Manatee County, you could send them to Carrington Place in Pinellas or Polk or Charlotte. We're working on bringing on a couple more of these facilities, but this way they're able to be isolated and not spread it into their home facilities. We started the Pan American, or the Miami-Dade Care Center, last week. We think that that's going to be filled probably within a couple days, and we have a number of in South Florida, Central Florida. We're also working, I know, the Tampa Bay area. They've dealt with a lot of nursing home outbreaks, particularly in Pinellas County, and that's been a concern. And so while this Carrington place is good, we want to see if there's ways that we can expand the footprint. But this is an important tool to protect residents of long-term care facilities who are the most vulnerable, but also, not needing to send, if someone is stable or asymptomatic, having a place where they can go where they're not going to infect other people, and they can be cared for. So I want to thank Secretary Mary Mayhew for really working hard on that. And we talk about the new facilities and the additional beds that we're bringing on every day for this. And just to show why this is important. So here in Manatee County, they've had, I think as of yesterday or as of this morning maybe, 138 COVID-related deaths. 91 of them have been related to long-term care facilities. So that's 66% of the corona-related fatalities have been linked to long-term care facilities. And so that's not only just saying 65 and up, but just 65 and up and then residents of these facilities. Sarasota County, close by, they've had 100 corona-related fatalities. 65 of them were related to residents of long-term care facilities. So again, 65%. So this is really, really a significant part of this fight. Social distancing, we have a much better idea now than in March about what the virus likes and doesn't like, and closed spaces. And I think you're seeing a lot of this activity throughout the entire Sun Belt. And some people have said it's because when it's hot, people would rather be inside and enclosed air-conditioned spaces. And the point is that if you're in an area where you have a crowd of people indoors, in a party or something like that, and the air conditioning, it is going to be a better vector for transmission. There's just no doubt about it. People's homes, obviously, most people get infected from family members or friends, and especially in the air conditioning, that's going to be something that's going to be a good vector. The outdoor transmission has not been as significant. The sunshine, the heat, and humidity are generally your friend when it comes to this virus. Virus doesn't typically like that. Would prefer to be in the enclosed environments. Big crowds obviously provide more risk, and then the close contact settings. When you're in sustained close contact with people, you don't even need to cough or sneeze. We think at this point, if you're talking repeatedly, and you're there for a long time, do it. So really the social distancing is very, very significant. If you maintain appropriate social distancing, you're not going to probably infect anyone or get infected. A facial covering, if you can't do that, is a way that could mitigate some of the particles that you may cough or sneeze or talk with, and could reduce some of the transmission. So if you're not in a situation where you can avoid the 3 C's, or where you can appropriately social distance, wearing the face covering will help you. And again, low risk versus high risk. This is pretty well, I think, well documented at this point. When we talked about flattening the curve back in March, part of the main reason was to make sure that the hospital system could cope with whatever happens in terms of the effects of the coronavirus. And in March, this was a very new virus, and we kind of knew in January it was out there. In Florida, we were testing people as they came back from Asia. Almost all of them were negative throughout February. I think we got our first case at the very end of February. We now know that it was much more widespread than we thought. I think it was the testing criteria that was very limited. But there was problems with PPE. There was problems with testing. There were all these issues. And so now we're in a situation where we've got a lot of test sites around the state of Florida. The hospitals are all testing. The private companies that are testing. CVSs are testing. So in March, it was very difficult to figure out how to test. Now it's a little easier, which is a good thing for people. And of course, we have drive-through sites, walk-up sites. We've got all kinds of different ways people can test. Federal government just did 3 sites in Duval County. They're doing 3,000 tests a day. They're not going to do it for very long. They're kind of moving around the country doing different things, but that's been good. We now have free antibody testing at 5 of our drive-through sites, 2 in Miami, the Hard Rock Stadium, Marlins Stadium, the one in Jacksonville at the Jaguar Stadium, Orlando Convention Center, and then the West Palm Beach site. We're at the Spring Training Complex. So if you're somebody who is not symptomatic, but you think you may have gotten this, the antibody testing may be better, because if you got it a month ago, you'll most likely pop for the antibodies, and then at least you'll know that you have it. The PCR test, you could have been infected a month ago and still pop positive, even though you would no longer be infectious. So take advantage of the antibody. It's not as easy as the PCR because it is a blood draw, and it takes a little bit more time, but you get the result in, I think, 15 minutes, and it's instructive, because if you have the antibody, that's important to know. The PPE situation is much improved. We speak with hospitals every day. I'm not at anyone say PPE is an issue anymore, and the Florida Department of Emergency Management has sent a huge amount of PPE, particularly to the long-term care facilities, but also around the state, and that's very, very significant. I mentioned the remdesivir. That is, we didn't have any of that in March. We now have the remdesivir. They're using this dexamethasone steroid. Some of the doctors think that that's been good. The convalescent plasma has gotten good reviews. So these are all things, these are all now tools in the toolbox, so that if somebody comes in, they can be treated for this, and hopefully improve their success. Another issue that we're working on are these lab reagents, the chemicals that go involved when you test the stuff. The problem is the US is testing more on a daily basis than any country by far, and the lab resources are backed up. Some of these turnaround times, they're supposed to be 48 hours. Some of the big commercial labs are running 3 or 4 days behind that. Some of the supplies are starting to run low, and so I'm working with the White House to try to get some more reagents down for our hospitals. I've spoken to a number of them that are concerned about this. Part of the reason, we're testing a lot of asymptomatic and a lot of healthy people, and those numbers add up very quickly. And I think the consequence of that is that you've seen some of these supplies dwindle across the country. So the lab reagents are something that we're really concerned about, and we're thinking about. I've mentioned before, and hopefully we'll have an announcement at the beginning of the week. We are sensitive to getting these test results back as quickly as possible. When we did our contracts with all these private labs, they were guaranteeing a 48-hour turnaround. Well, that's just not in the cards really anywhere in the country for what we're seeing. We do, though, have some companies that have the ability for us to do self-swab tests, and then they can turn it around, and they say 36 to 72 hours. That's what we're doing with our long-term care testing. So once we tested all the residents of long-term care facilities, we tested the staff. We said, okay, going forward, we need to just test the staff every 2 weeks, because if they're asymptomatic, they bring it in, they infect, it can spread in these long-term care facilities, and we've seen that happen. So we have an arrangement where we do these tests now every 2 weeks. So far, they've sent in about 130,000 tests. We have 86,000 test results, and only a 2.8% positivity rate for staff in long-term care facilities, which is a little surprising, because if you see the prevalence in other parts of the state, some places you're at 15-20% prevalence in PCR testing. So to see the 2.8, that was quite frankly, somewhat of a surprise. It's a good sign, but we're going to be getting in 190,000 roughly, test results every 2 weeks just from staff of long-term care facilities. This has been a good model. We want to be able to try to figure out how we can get people their results back as quickly as possible. We're focusing that on symptomatic people. Most of the people that are coming to test don't necessarily have symptoms. They kind of just want to know if they have it. Well, if somebody has symptoms, we're going to work on dedicating some of the drive-through lanes for those people, and then having them do the self-swab, sending it to some of the companies that may be able to turn it around a little quicker. I think that is something that would really make a difference. And the thing about like testing the asymptomatic people was, okay, well, if you're asymptomatic, you can spread it, so get tested, then if you're asymptomatic, you can isolate. The problem is you don't get your results back for 7 days. I mean, what are you supposed to do? Are people just isolating if they're not positive? Most people probably are doing that. And so it made sense in theory, but just given the resources with what we're seeing with commercial labs, and then the contact tracing, if you're asymptomatic and you get a result back in 7 days, it's going to be a lot harder than to go back and contact trace who you were with, 2 weeks ago. It's a lot different if you get a quick result and then you can say, yeah, 2 days ago I was here. So, but the lab reagents are running down because of just the total massive amount of testing that's being done on a daily basis, and that's just not in Florida. That is nationwide. So, I want to thank everyone for coming. We're going to pass it around. Folks can make some comments. Then we're going to have a little bit of a discussion, and then we'll open it up to some questions. So, President Bill Galvano, floor is yours.
Thank you very much, Governor, and welcome to Bradenton, Florida, Manatee County. We really appreciate you being here. Thank you, Dr. Chari and CEO Kern, for having us here at Blake Medical Center this morning. I remember very clearly, it was several months ago, we were in session and you, Governor, called me and you said, Bill, guess what? We have our first recorded cases of COVID-19 here in the state of Florida. And one of those was right here in Manatee County. The other was up in Hillsborough County, just north of here. And so it began, and from there we had to navigate what has been a changing landscape, a challenging landscape, but one that is very, very serious and changed the way of our lives and the way we conduct business. And I'd like to thank you, Governor, for the way you've handled it. You've been very measured, very patient in terms of what we have done to respond. There was not a shoot from the hip mentality that took place in your office and frankly in the leadership of the legislature. And because of that, I think we've responded well. And I would like to underscore a message that you've been sharing when you have been speaking with the public about the data, and it's a big picture about the data, is that when you analyze data, you have to analyze it all. You have to understand every aspect of it. You have to understand its source, for example, how many tests are being taken, how does that compare percentage-wise to the death rate, to the hospitalization rate, all of those things. And too often what I'm hearing is just a single message, just a one message that says, here's what has been tested and here are our positive rates. That doesn't really give the clear picture of how we are doing here in the state of Florida, which is frankly better than most of the other states here in the union. And that same type of measured approach, it was a real pleasure working with you on the budget. As you recall, we got out of session and had a budget together with the speaker, and I decided we should probably take a little more time and put additional buffers in there for reserves, and which we did, and then we monitored and we watched and we collected data, and because of that, we were able to sustain a budget that came out of this last session with many, many funded programs that represent the dreams, goals, and desires of constituents throughout the state of Florida. And here we are now, very securely into our next fiscal year with that budget. Now, granted, you had to be necessarily a little more aggressive with your vetoes, but nonetheless, that same type of patient measured approach ruled the day and proved to be successful. Here in Manatee County, we've had our challenges, as you pointed out, significantly. They are within our nursing home community, but we've had good leadership here. We've had tremendous leadership from our county commission, our elected officials, and they have responded in a very professional, reasonable, and practical way here, our medical community as well, and in large part have followed the standards that you've set forth in your executive orders in terms of how we've responded. And because of that, we have been in pretty good shape here. The Department of Emergency Management has been very helpful to my entire district, but in particular Manatee County, in terms of making sure we have testing sites, the PPE, other types of support that were necessary for us to continue and to sustain ourselves and have stability through this crisis and pandemic. And I feel confident that we will continue to be able to handle it, and look forward to continuing to work with Director Moskowitz and yourself, Governor. And so, I want to congratulate the county that we are in, and I want to thank you again, Governor, for what you've done in terms of managing this pandemic. And I know we're going to hear from the medical experts here at Blake, and I guess you want me to just turn it over to our CEO here, Curran, or do you want to go back through the chair?
No. Go ahead. Yeah, absolutely.
Well, Governor, I appreciate you coming here today, and President Galvano, thank you as well. It's an honor to host you today. I think if I would convey one thing throughout this process, to their point, is that it's been fluid and it's changing day to day, sometimes hour to hour. But at the beginning of all of this, both as an organization and as well as a facility, we've really focused on a couple of things. One was protecting our workforce so that we could ensure that our facility was here to support our community throughout all of this. And we did that with 4 main focus areas. We continue those focus areas today, quite honestly. The first is infection prevention, and that has a couple of different pieces. The first is universal masking. All individuals within the facility, both our caregivers as well as our medical staff, and any visitors, vendors, etc., go through a screening process and are universally masked. PPE, the governor mentioned that, and we've been able to manage our PPE here to effectively ensure that our caregivers have the appropriate PPE for the appropriate patient. And then we constantly are focused on disinfecting. The second is access control. We have a screening process with our points of entry where everyone who enters into this facility, whether it is a caregiver or a medical staff or a vendor, goes through a screening process. I'm sure all of you went through that process today as well, and we ensure that those individuals are masked and remain masked here. And we've also limited our visitation. Inpatient visitation has been limited here only to certain situations, and that's been very effective, we believe, in helping to ensure that the community spread has not gotten within our 4 walls. Distancing is the third. We focus on social distancing just like everyone else does in the community, but we also focus on distancing our patients, ensuring that those patients that are either COVID positive or persons under investigation are in particular units and there are no instances of cross-contamination. And then finally, patient flow. We want to ensure that our patients are moved throughout the facility in the most direct manner possible so that we can ensure that we're also, again, limiting potential exposures. So again, Governor, thank you. Appreciate the time, and President Galvano, thank you as well.
Great. Dr. Chari, West Florida Division President for HEA. Go ahead, sir.
Thank you. Thank you, Governor. Is this working? Does it feel like you can? I think I can speak it loud now. Okay. Well, I want to start off by thanking the Governor for being here today, and I also want to thank President Galvano for being here as well and helping arrange this. Bill's right. This started with a patient from Manatee County. It was actually one of our hospitals in HCA, first hospitalized patient in Florida. And I remember the Monday after that, Saturday and Sunday, the governor came down to Tampa and had his first press conference about this, and I was so impressed with him at that time. And then today, having the chance to sit with him over lunch and speak about his understanding and his focus, I was so impressed, continue to be impressed. That stack of papers he has beside him there, he actually knows all of that, because he knew what page to turn to right away, and he knows what's going on. So thank you for that. I want to talk a little bit about our division, HCA Healthcare West Florida, and it'll give me some perspective to talk about some things and reflect on the context of which the governor as well as CEO Curran spoke about. So we're in 10 counties on the west coast of Florida treated last year over 1.2 million patients. We have 15 hospitals, 27 ER locations, 13 ambulatory surgical centers, numerous physician practices, and we have over 750 graduate medical education physicians in training in our programs. In fact, we're in a GME room here at Blake, so we're among the largest programs in the state for that, and it gives us great perspective and understanding training the next generation. We have a regional lab, and we have a service center as well. And we're part of a system within the state of Florida where we have over 50 hospitals. And there are a couple of things that I think are really important at this perspective. One, I'll reflect on what the governor said also. In our system, to date, we've had close to 4,000 COVID positive patients in our 15 hospitals, almost 40,000 tested. And one of the things, as he uniquely said, is we see different regions. Our hospitals are spread 4 south of the Bay, 4 north of the Bay, 4 west of the Bay, and 3 with 4 campuses east of the Bay. And as the governor said, we see different ranges of activity. And as he said, south of the Bay right now here in Manatee, it does look like it's not quite as active as other areas. We see the activity he talks about in Pinellas with the nursing homes, and so very appreciative of his insight and the help that he's bringing and helping us achieve. I think the other thing I'd like to say that gives us perspective is, with the help of the state and the leadership, specifically of Secretary Mayhew, I'll underscore that our hospitals are safe and open, and a message that I would send, and I know the governor understands as well, send the message to everyone else that yes, COVID is an important disease that we treat, and we're safe. And by the way, we're open also if you have any other significant medical emergencies, because we can't miss on treating those as well. The last thing I'll end on with respect to this area is I'm also very proud of our sister hospital competitors, I guess is the right word in usual times, as we've pulled together in a very unique way, in my opinion, a unique way to support our communities. We share data every morning. I know how many COVID patients there are in different systems. This system has a unique report. 12 counties come out every day, where we have 77 hospitals, and so we're working together to support in the areas that we work together. And clearly, the governor is aware of those. He mentioned those 3 areas. I brought it to him. Number 1 is the urgency around staffing and the support that we need to ensure that we're able to respond to this rise in cases. The second area that he spoke to that is very close to us is nursing homes and the ability to move patients into other areas, and he spoke to that with his slide, and continue to be responsive. As we said even today, we need to continue to expand that, so we'll continue to work with him and Mary Mayhew. And the third area is around testing, and again, his deep awareness and knowledge of not only we need to do the tests, we got to have the reagents, and we got to make sure that we're getting these tests back in a timely way so that we can minimize the impact it has on length of stay as well as use of PPE. So again, I want to thank the governor for coming here, thank him for his leadership, and continue to work with him and his team at Tallahassee to improve and our ability to care for patients not only in Manatee County but also the West Florida region. Thank you.
Great, thank you. Chari, did you want to go, Manatee County
Sure.
Administrator?
Thank you, Governor, and really appreciate the opportunity. Just to mention a little bit about Manatee County, where we're at right now. About 411,000 people here in the county, where our goal is right now at about 12.5% of the population tested, and we're very focused on following the governor's smart, safe, step-by-step plan, and it includes this ongoing robust testing. That's been a real key for us. As was mentioned earlier, we struggled early on with our long-term care facilities, and I'm really happy to say that with a lot of the different things that the governor has instituted, those seem to be coming online, and it's given us a more deeper and richer understanding of what's happening here locally for a lot of our elders. I think at the local level, a lot of people wonder what goes on behind the scenes when these kinds of emergencies happen, and we're so proud of the relationships that we've built both with our facilities such as Blake Medical Center and CEO Curran and the staff here who have been extremely helpful. Has been mentioned. Statistics every morning are very important to us as a county. Our Board of County Commissioners stepped up early on when we were lagging in some of the testing area and supported some local emergency funds in conjunction with MCR Health locally here, and then the governor's office as well as Senate President Galvano came through with a regional testing site at UTC. We have the walk-up facility at Lincoln Park. We have now at Home Depot on Cortez here. For those of you that need places to go, these are all available. We're averaging about 3,000 tests a day and those 3 public facilities, and then of course all of the other testing that's going on. And so we feel that we have now come in line with the state. We've come in line with some of the metrics that are needed. And one of the other interesting things that's going on right now on the local level for us, and I'm sure across the state, and I know the other county administrators would want me to also say thank you to the governor for getting the Manatee CARES Act fund out to the local governments. We're balancing, bringing the economy back locally. On Tuesday, the 14th, we roll out our Manatee CARES program, which is a business recovery program. But let me emphasize that in the early stages of that, it's focused on sanitizing, renovating your facilities for safety, of course, practicing good hygiene, wearing, hopefully staff having access to PPE, and then also being able for those businesses to bring back their employees to come back. So it's just been a very rewarding experience. I have to say that our emergency management staff, again, Public Safety Director Jake Sauer here locally, Steve Lichauer and his emergency division, along with our Department of Health Executive Dr. Benzie. They've been fantastic, and it's really a group effort. So we want to thank you. We want to thank Senate President Galvano, and I know Representative Robinson is here too. They check in with me regularly as the county administrator, and we work with our board to try to make quick decisions. So thank you for letting us update you on the local status.
Great, thanks. Then we also have Blake Medical Center Director of Emergency Management, Dr. Scott Self. So Scott, can you go ahead and take it away?
Sure. Thanks again for coming, Governor DeSantis. If I had one message to deliver to the community, I want everyone to know the hospital, specifically the ER, is safe. As Randy mentioned, you have a hard time hearing me?
Not quite
As Randy mentioned earlier, we've implemented many things throughout the hospital for patient safety. So that includes things like universal masking, separating patients out that could have symptoms of coronavirus from those who don't. Many things we've done for months. And I'm concerned, as well as a lot of healthcare givers, that patients are ignoring their symptoms. At the height of when this set in March and April, the ED across Tampa Bay, we were seeing 50% volume drops. These weren't just low acuity patients, these were chest pains, strokes that were waiting and delaying their symptoms or presentation. It's gotten better, but we're still 15 to 20% down from prior year. So it tells me that patients are still not coming in. We're seeing delayed heart attacks and strokes. And I would really just want the community to know that we're a safe place. A testament, I guess, to wrap up to that point is that in Lake ED, over the past, since this began, 4 months or so, we've diagnosed over 300 coronavirus cases, most of which were discharged home. And I've had 0 doctors and 0 physician extenders contract the virus. So that's from appropriate PPE and safe things that have been implemented. So I would just want the community, please don't ignore your symptoms. We're here for you, we're here to help. And I think that's all I have to say. Thank you.
Well, no, I think it's a really important message, and I appreciate you delivering that. When the coronavirus emergency began in March, obviously there was a lot of discussion about it. There was really, I think, a sense of fear on a lot of the members of the public about what the virus meant for them. I think a lot of people were very apprehensive, and consequently, you saw a real significant drop in ED visits for things like heart and stroke. Now, those things don't just get cured or stop. I mean, those are kind of consistent maladies that happen. And so CDC looked at it and identified, the big percentage of drop and theorized, and I think this makes sense. I mean, people were scared to come into the hospital because they thought they were going to actually get infected with coronavirus. which I think, as the doctor said, is not going to happen. I mean, this is one of the safest places you can be, but they were fearful of that. And then I think others, thought that there was, all the hospitals were doing was corona, all their beds were filled with coronavirus patients. Again, that's not true. Even as we've seen, more prevalence in the last 3 weeks, more ED visits and more people, more traffic in the hospitals. The bulk of what they do is not coronavirus. I mean, they're doing the other stuff that is so important. And so if you have those symptoms, you need to go in and get the medical care you need. Every hospital in Florida will tell you, we want you to come in. And so we don't want to see, that decline, because what happens now, and I think you guys can probably attest to this, but I know I've spoken to other doctors and CEOs of hospitals. Some of the people that are in intensive care now for things other than coronavirus, their condition worsened because they didn't go in when they needed to go in. And, you don't want to be in a situation where you're doing that. So you agree with that? Is that what you guys are seeing?
Absolutely true. A lot of delays, or certainly it's improving now as we've opened up again, but certainly in the immediate past, right after the lockdown, there was a lot of folks who delayed symptoms. And as Dr. Self said, if you're still out there and concerned, don't be. The years are safe. Come in. Don't ignore your symptoms.
Can you just, you'd mentioned kind of like a survey of kind of the Tampa Bay region. You kind of got Sarasota, Bradenton, where the prevalence seems to be a little more stable, hopefully even declining. Pinellas, obviously we've had a lot of nursing home issues there. And then kind of north of that, which was quiet for a while, Pasco and stuff, you started to see more prevalence there.
Well, I think Governor said sort of over the time that we've been looking at this, early on, quite honestly, this area was a little bit more active south of the Bay, as we call it, with our 4 hospitals. And in the background, then Pinellas has had a lot of nursing home activity, as has Hillsborough. However, in the last 2 weeks, to your point, clearly north of the Bay, we've seen increased rates right now in the growth rates over the last 7 days of 12 to 13%, which another way we think about it is doubling time. The doubling time is roughly about 12 days to double the number of cases. So we're clearly watching that area carefully.
How are you doing on PPE compared to March? It seems like those, I know we've sent out a lot with emergency management, but it just seems like those distribution chains have loosened since kind of the panic in March.
Yeah, I think you again understand the situation very well. As Randy mentioned, we have put in a very tight process around PPE management, so we managed it well. And then as this resurgence has come along, we still continue to have good supply. Certainly the allocations have been very helpful along the way. And again, as we've retightened our system and process in the last several weeks to ensure that we have the inventory on hand to take care of patients. So
I've been discussing the COVID-only long-term care facilities that we've established, both in terms of a step up from a long-term care. If they're positive, they can be isolated, but also a step down, because a lot of these folks who are positive don't require hospitalization, or they become stable, which is a good thing. So you guys you're utilizing Carrington Place and some of these facilities to transfer some of your COVID positive but medically stable long-term care residents?
Absolutely, it's an important part, and we continue, as we talked about over lunch. I appreciate your help in any way we can to expand that, because it becomes a challenge in the hospital to, as Dr. Self mentioned, we have patients coming in, and then the other side of that is moving patients out is something we need to do to maintain that flow and throughput.
Great. Yeah, no, we're looking to do, Carrington Place is about 60 beds. We also have Oak Bridge and Polk, which is over 100 beds. We have a facility in Charlotte County, but we'd like to get another one in the Tampa Bay area. I know that Secretary Mayhew is working with some folks to try to do that. Let me ask Bill Galvano, just how's the economy doing here? I mean, obviously, it's March, beginning of March. I think things were humming along really well. That obviously changed as that month went on. Are people, getting back? What's it like in the Sarasota, Bradenton area?
Yeah, and you're exactly right. Test. Did you break it? Yeah, there it is. Okay, back on. Wow. So,
Okay, yes, we like the rest of the state of Florida, we're just, as you say, humming along as we entered into the new year. A lot of growth in the eastern part of our county, a lot of new businesses coming all throughout, actually, my district that includes Hillsborough County. And then, of course, we had the shutdown and experienced very consistently here in Manatee County what was being experienced around the rest of the state. We are coming back. The step-by-step, the measured approach that we worked on, and I appreciated the opportunity to work with you on that approach coming back has helped us begin to rebuild little by little. Our county commission, again, I have to recognize their efforts as well as Chari West's efforts in making sure we maintain that balance between public safety, which of course is paramount, but to understand the implications of not monitoring and not supporting the opportunities economically that need to come online when they need to come online. So we're seeing a comeback, and it's slow but it's steady, and we're going to stay on top of it and make sure that we're not taking steps that are going to put us in a stale position. And frankly, Governor, I don't want to see us go backwards either. I mean, we're learning every day about how to handle this pandemic, and our economy still needs to move forward. And so let's make sure we're still doing that.
Great. So Dr. Self, can you talk a little bit about the kind of the demographic age breakdown of some of, you had mentioned some of the traffic you're seeing in the EDs lately, kind of the age breakdown, what do the symptoms look like, and then within that, the folks who tend to have the most problems in terms of any comorbidities they may have.
Sure, thank you. At first, I can speak locally, it seemed that this was affecting the elderly more in nursing homes, and it seems that we got a better handle on that, and I can say that anecdotally over the past month or so, we're seeing it affect the younger population more. I'd say between 30 and 45 years old. Most patients, thankfully, are able to be discharged home. Of course, some of them can't be, and we need to care for them. I would say that the patients that have a challenge with this would be those patients that have other comorbidities like diabetes or morbid obesity. But for the most part, and if you're young and healthy, you do very well with this disease, and we've been able to manage it. So I'd say a younger patient population than the past month or so.
Great. Well, I want to thank everyone for coming, and thank you for what you're doing here in the Sarasota Bradenton area. I think you guys have handled it very well. We're obviously not done with it here, but the trends seem a little bit better here than they may be in some of the other parts of the state, so we really appreciate that. We also just thank the folks who've been working so hard, healthcare workers, our first responders, and then just all the Floridians who've really worked hard, just doing the basic things that the people have been talking about to protect themselves and to protect their families.